organization. Is a nonprofit organization that focuses on providing high school and college students a platform to gain experience in different healthcare fields, whether that be medical, dental, or in mental health fields. So we're very excited that everyone has joined us here tonight. To introduce myself, my name is Ariana Zargami. I'm currently a senior in college at Vanderbilt University, and I'm going to be one of the moderators. I'm going to turn it over to Della. She's our webinar coordinator, to introduce herself.
Hello, everyone. My name is Della Zhang. I'm the webinar coordinator of First Aid on Site Foundation, and I'm also a student of Michigan State University, majoring in psychology. So that's all about me. Now back to Ariana.
And our other webinar moderator tonight is going to be Dane. You want to go ahead and introduce yourself, Dane?
Hi, my name's Dane. I'm the other moderator. I'm a junior at Detroit Country Day School, and right now I'm taking an AP psychology class. So I'm really happy to be involved with this first aid on site, or be involved with this first aid on site like presentation. And I don't know, I'm just happy to be here. And Ariana, I'm going to pass it back to Ariana, who's going to introduce Dr. McLntyre.
Thank you, Dane. Yes, we're very excited and grateful tonight to have our keynote speaker, Dr. Carmen McLntyre, with us. Dr. McLntyre will be going over different career paths in the mental health field, and after her presentation, there will be an opportunity for a question and answer session. So if you have any questions, feel free to type those in the chat for Dr. McLntyre. So thank you so much again for joining us tonight, Dr. McLntyre. We're very excited to have you, and I'm going to pass the floor on over to you.
All right, great. So good evening, everybody. I am Carmen McLntyre Leon. I am the Chief Medical Officer for the Michigan Department of Corrections. I am Associate Chair for the Department of Psychiatry over Community Affairs with Wayne State University, the Director of the state's Public and Community Psychiatry Fellowship Program, Interim Chair for Neurosurgery, and on the board for First Aid On-Site Foundation. So what I wanted to do today was go over with you some of the types of mental health professionals that there are, career or educational paths, and then some career opportunities for each of those. So hopefully, hover the edge. Okay. So I'm going to be advancing the slides. It looks kind of weird on my screen, so I'm not sure what it's doing right now. Okay. So the agenda that we've got today, I'm going to be defining different types of mental health professionals, reviewing the educational path that they have, some of the licensing requirements if you plan to practice in Michigan, and then some of the career options, kind of areas for each of those fields. Okay, so first, because we're talking about mental health, I think we should all be on the same page about what mental health means. So health overall, I'm a physician, I'm a psychiatrist, and so I practice medicine. And what we try to do is we try to achieve optimal health and well-being in our patients. So what does that mean? So health is a state of well-being where we're addressing, I don't really like calling it this, but most people typically call it the physical area, mental health area, and social areas. Mental health includes psychological as well as emotional well-being. And so that's what people usually think of as mental, so being both psychological and emotions. And mental health, being in a state of optimal mental health means that we can realize all of our abilities, we can cope with the stresses that life throws our way, and we can make contributions to our society. Looks like this moved back. Okay. So the different the different mental health professionals that we're going to be talking about today. First are counselors and social workers, then psychologists, psychiatrists, and then a little bit about nurse practitioners and physician's assistants. All right, so starting with counselors. So what are counselors? So you hear the term a lot. You hear school counselors, or I'm going to see a counselor. And I think there are a lot of these degrees will frequently get called counselor or get called therapist, but there's actually a degree in counseling. You study counseling theories and techniques. With all of these, you're going to study ethics and psychological development. And the goal of a counselor is to achieve mental health. They're also very involved in education and frequently are involved in helping people discover a career path. So doing aptitude testing where they see kind of what your skills are, what your interests are, and then figuring out where you want to go with your career. So they frequently work in schools. They can frequently are doing therapy, both for marriage counseling and family counseling, as well as individual therapy. I mentioned doing a lot with vocational and career counseling, and frequently in substance use disorders. So first you have to do a bachelor's degree. So that's what we frequently call your undergrad degree, your first 3 to 4 years of college. And then is a master's degree. Without that master's degree, you really won't become a licensed professional counselor. And so very difficult to find a job without the master's degree. Master's degree is typically 2 to 3 years. After that, you pass a national exam. There are at least 3 certifying bodies right now that have an exam that they offer. And then from there, you can obtain a state license. So you do have to know that in order to be fully licensed in Michigan for both the counselor and what we're going to talk about shortly with the social workers, when you first come out with your master's degree, then you work under supervision of someone who's fully licensed before you then take your exam and then can be fully licensed in the state. Okay, so, oops, I think I went too far. It's a little bit delayed with this remote control, so I get, I'm not a patient person, so sorry about that. Next is social work. So there are bachelor's level social work degrees, but really in order to practice in the state of Michigan, you really need your master's degree. So like the counseling degree, you start off with your undergrad, 4 years, 3 to 4 years of undergrad. You can get a bachelor's in social work. You can also get it in counseling. You can get it in other human arts. And then you go on to a master's degree, which is typically 2 to 3 years of graduate study. It's a little bit broader field than counseling. The state of Michigan in particular, I'm not as familiar with other state rules and regulations around it, but for a lot of the employers that are out there, they prefer hiring a master's level social worker over counselor, and it has to do with community mental health, who can bill for what, etc. There have been efforts to get some laws changed to expand the scope of practice for counselors, but right now, between the master's level counselors, social workers, and psychologists, the social workers have the greatest flexibility in what they'll do and what they can bill for. So they can be in private practice, they can work in community mental health centers, they can work in hospitals, but where it gets even broader than what the counselors can do is working in research, working in administration, working in government, and working for public agencies. So like counselors, they can work with individuals, couples, and families, or for example, doing group therapy, but they frequently also will work in agencies, in governments helping to set policy, and coming up with general health plans. Many of the folks that work, for example, with the Michigan Department of Health and Human Services have master's or doctoral degrees in social work. Like counselors, they do assess mental health problems. Depending on who's paying for the services and who you're working for, they may or may not be allowed to actually diagnose the illness, but they can at least assess problem areas, if not actually come up with mental health diagnoses. So after bachelor's, like I said, it's 2 to 3 years of master's program. Then there's the Association of Social Work Board exam that you have to pass. And in order to sit for the exam and then get fully licensed, you have to have many hours. It's about 4,000 hours of supervised clinical experience or educational experience. And it can either be in clinical or macro field of study. Macro looks more, so let me back up. Clinical would be working one-on-one with a person or a couple or a group during doing therapy. So a clinical focus prepares you more to do that kind of clinical work. A macro focus is one where you're focusing a little bit more on research and policy development. So this is where working for public agencies, in public health, for governmental agencies, and where you're looking at the broader sphere, not just working with one person or a couple, but setting policies to improve health at a larger level. Okay, so next should be the psychologists. So psychologists, psychology is the study of the mind, and psychologists after a bachelor's degree may have a master's or a PhD. And I'm going to talk a little bit about what a PsyD or a PhD is, but in the state of Michigan, as I said, the rules are heavily weighted toward master's level social workers. So master's level psychologists don't have as much flexibility in their practice as master level social workers. So master's level psychologists will frequently work, for example, in intake settings, assessing people's problems. They do frequently have more flexibility or more permissions, I should say, in actually applying diagnoses as opposed to just determining problem areas. But you really need the doctoral degree to do what a lot of people associate with psychologists as doing psychological testing, to help determine what a person's area of problems are. So psychological testing can include IQ testing. I will frequently refer people to psychologists when I'm having a hard time determining if this is more so a personality disorder, if it's more so a cognitive disorder, or if it's actually a depression, for example, or psychotic disorder. So PhD, which stands for Doctor of Philosophy, and a PsyD, which is a doctor in psychology. So the PhD will teach you both clinical aspects, assessing mental health problems, diagnosing, and doing treatment. Whereas, and it also includes the research aspect of it. The PsyD more purely focuses on the clinical aspects. So if you're interested in working with patients, doing psychological testing, doing therapy, that kind of thing, you might think that the PsyD sounds like a better option for you. Here's the problem. For all of these, when I'm talking about getting a license, being able to sit for the certification exam, they do require you to get your education through an accredited program, all right? So taking a look at accredited programs in Michigan, there are, I believe, 11 psychology PhD programs that are accredited in Michigan, but only one PsyD program. And it's pretty much that way in most states. So the PsyD is attractive, but you have to be very, very careful. I'm aware of other schools out there that are not accredited, which then delays the time that it takes for you to get your license. And I've actually had folks that had their master's in psychology, wanted to have greater job responsibilities as well as pay in places where I've been the one who's been doing the hiring. And even though they went to a PsyD program, that program wasn't accredited. And so it impacts their ability to get a license. So just be very careful about that. In most states, psychologists do not prescribe medications. There are a couple of states where you can do a training programs typically for at least a year. And then you can take an exam and then be able to prescribe. At one point, I know that the US Army had a program where psychologists could take this kind of program, take the test, and then prescribe if they pass the test. I happen to know that because I was one of the people who wrote the exam questions for that test. But in Michigan, they do not prescribe medications, and in most states they don't. All right, so going on to psychiatrists, as I said, I am a psychiatrist. So we are physicians. We are what people usually think think of when you say a doctor. So after our bachelor's degree, then we go on to either medical school, and that's your MD, or to School of Osteopathic Medicine, and that's your DO. So we then have to pass national exams. They're usually broken down for MDs into three parts, national exams. So we usually you can take them all when you finish med school, but most people will take one at the end of their first year, one at the end of their second year, and then the last one toward their end of medical school. After that, then we go on to do residency. So a psychiatry residency, the standard residency is 4 years. In our first year, we typically will do rotations in internal medicine so that you learn about the general workings of the body. Things like, you'd be surprised, things like diabetes or hypertension can actually affect your brain and how you're thinking and how you're functioning. We also rotate through neurology and lots of other things during our 4 years. After that, you can go on to specialized, or you come out as a generalist, which is adult psychiatry. There are some programs that allow you to leave after your 3rd year of residency to then go do child and adolescent psychiatry, for example, as a specialization, to do addiction medicine, to do geriatric psychiatry, etc. Or you can, if you're in Michigan, you can come do my public and community psychiatry fellowship. So there is a board certification exam. So it's for general or adult psychiatry, as well as any of the specialties. So you have to have completed your training in an accredited program, then you take the exam. There are 2 parts. There's a written exam, and then there's an oral exam. And then we have to test, we have to renew that testing every 10 years to show that you have a certain level of knowledge and competence in psychiatry. You don't have to get your board certification, but many places of employment require the board certification, and frequently for insurance, there are lower rates if you're board certified. So what do? We assess and we treat illness. And illnesses of the brain are medical illnesses, the same way illnesses of the heart are medical illnesses, illnesses of the GI system are medical illnesses. So it just so happens that the illnesses that we treat typically have some sort of behavioral and emotional component to it. So what's different about diagnosing depression between a psychologist and a psychiatrist? Because we're both looking at the same outward symptoms that you can see and that people complain of. Things like, having a sad mood, sleeping too much or not being able to sleep, feeling anxious, not having any motivation, etc. So the difference is, because a psychiatrist has gone to medical school, We're also looking at other things. Is it because there's a thyroid problem? Is it because there's a cancer in the lungs that actually can secrete hormones that affect your brain? Is it because of abnormalities in your adrenal glands that sit on top of your kidneys? So we order laboratory testing, blood work. It might include brain scans, etc. We also prescribe medications, although we don't have to. Not every mental illness requires medication to be treated. And then we can treat the side effects from those medications as well. A lot of psychiatrists now are practicing what they call functional medicine or holistic medicine. So not just kind of staying focused on the depression. So if I find out that your depression is because your vitamin D levels are too low, I'm not necessarily referring you to a family practice doctor. I'm going to treat those low vitamin D levels. Okay. So next. Okay, so next we have physician assistants. So physician assistants also complete their bachelor's degree, and then they complete a master's. Typically, most people do it in 2 to 3 years. And it's a master's of science in physician assistant program. Okay, so this is a medically based program, and it's very, I would say, non-specialty specific. So training in all the areas of health, such as, being able to assess, diagnose, and treat things like diabetes, hypertension, those kind of things. They have to pass a national exam and then obtain a state license. It's under the Board of Medicine, the same way that physician licenses are. They may practice independently, but most work settings and many states require them to work under the supervision of a physician. So in my work settings, in the companies that I've run, and currently right now with work with the Department of Corrections, they're seeing patients independently, they're treating patients independently, but they have regular supervision by a physician, either an MD or a DO, who's reviewing their caseload, reviewing their records to ensure that they're treating appropriately. The interesting thing, because it's so general, they don't have specialization. They specialize by working in a certain field. So it's easy for them then to switch. So someone coming out of a physician assistant program, their first job might be in a family medicine practice, and then they decide they're interested in working with children. So then they go work with children, then they're interested in helping to deliver babies. So they go work for an OBGYN, and then they get interested in psychiatry, and then they go work there. Next are nurse practitioners. So nurse practitioners, it's a nursing field. So their licensing and certification is under the nursing board, not under the medical board. So you start with a certified nursing program, again, with a bachelor's, typically done in 3 to 4 years. And then you get licensed as a nurse after your national certification exam. What's different about nurse practitioners is that they then go on to do a specialized master's program. And there are 4 different types of advanced practice nursing. So advanced practice meaning after your original bachelor's and you've had some couple of years out to practice frequently. So there's nurse practitioners that I'm going to talk some more about. There are certified nurse midwives, so the ones that help with delivering babies. There are certified nurse specialists, which Michigan doesn't recognize a difference between a CNS and a nurse practitioner. And then there are CRNAs, which a lot of people have heard of, that's certified registered nurse anesthetist. So doing work similar to what anesthesiologists do. So for nurse practitioners, they take a specialty course. Typically, it's a master. You can do a master's program, which is typically 2 to 3 years, or you can do a DNP, which is a doctorate in nursing practice, which is 4 years. You don't have to do the master's first and then do the doctorate. And typically people will specialize either in family medicine, pediatric and neonatal medicine, psychiatric medicine, or emergency medicine. So as I said, the certification is through and licensing is through the nursing board, not through the medical board. And like physician assistants, they diagnose and treat illness, prescribe medication. Michigan is what's called a restricted practice state. So there are only 27 states in the US that allow them to practice independently. Everywhere else, they're required to practice under the immediate supervision of a physician with agreements, written agreements with them. So technically, for example, in my practice, when I had nurse practitioners as well as physician's assistants, on my caseload, I had, let's say, 300 patients, and there was a subset of those that a PA or an NP could see, but they would have to meet with me at least once a month, go over all of the cases. They, couldn't prescribe certain categories of controlled substances, things like that. So, I just had this little graph here to kind of roughly show you the minimum number of years in order to be able to have a maximal practice opportunities in the state of Michigan. So for physician assistants and nurse practitioners, you see 6 years. It can take people a little bit longer, especially if they're going to, training part-time, et cetera, et cetera, et cetera. Or for the nurse practitioners, if they're getting their DNP, that would be at least another 2 years. For psychiatrists, it is a minimum of 12 years after high school, and you can have additional training if you go for additional certifications. The psychologist, like I said, you can stop at roughly 6 to 7 years with a master's, but Michigan is heavily weighted toward master social workers as opposed to master psychologists. So if you want to have maximal career opportunities and income, you really should go for the doctoral degree, and then there's some post-grad experience that you need before you can get the full licensing. And then for the social worker and the counselor, the schooling part is 6 years unless you go on to a doctoral degree, which you don't, unless you want to go into administration, leadership, or do research, the doctoral is not required. But unlike with the nurse practitioner and the physician assistant, your internship experience is not included in your schooling. So that's why you see this, additional post-grad hours for these that you have to do in order to get your full license. So, and on this last page, I just break it down, excuse me, in the raw numbers. So that's all I have for my formal presentation.